Assalamu alaikum. Very good morning to you all. Respected Chairperson, Professor Parveen Shaida, uh, Chairman or President of Medical Oncology Society of Bangladesh, Senior most radiotherapist or oncologist, Professor M.A. Hai, Director, Cancer Institute, Professor Azizul Islam, Major General Azizul Islam, Secretary of this society, and all other teachers and professors like Professor Sheikh Ghulam Mustafa, uh, Professor Sarwar, and other dignitaries, and the leaders or the specialists of some of the countries like USA, Japan, Singapore, Sri Lanka, Nepal, India. I thank all of you because you have taken a lot of trouble to come to Bangladesh for long way, and I hope your presence and the dissemination of your knowledge will help a lot of people of or oncologists of this country. I pay my deep respect at the outset of my father of the nation, Bangabandhu Sheikh Mujibur Rahman, and I pay deep respect to Bangomata Sheikh Fazilatunisa Mujib and all the martyrs of 1975 and all the liberation war freedom fighters who sacrificed their life during our liberation war. I also thank the Indian government who helped us during that period, and also our neighboring countries also supported us like Nepal, Bhutan, Sri Lanka. They also supported during our liberation war, including the India. Today, this summit is empowering the cancer care. You all know, previously in our country, the death rate was much more from CD, communicable disease, that is communicable disease. Nowadays, all the patients suffer and dies from non-communicable disease, and cancer is one of the leading cause of death in our country. Oncologists are giving much more service, but still in our country, the if we want to make one specialist per lakh in oncology per 1 lakh, it is needed of about 1600 nowadays. But in our country, the oncologists are very few, so it should be increased. One of the speaker, that is the secretary, asked me, as I am one of the planner or I am making the postgraduate in our country in through my university, all the postgraduate MS, MD, MPhil diploma, it is being given from Bangabandhu Sheikh Mujib Medical University. Medical oncologist, radiation oncologist, every in all sectors. There are three sectors, I think so: radiation oncologist, medical oncologist, surgical oncologist. This should be increased in our country. And as I have the opportunity, I hope the department and the chairman and the divisional head of this medical oncology, if they pray to us, we will increase the number in future to at least help the people of this country for dying from cancer. In our department or in Bangabandhu Sheikh Mujib Medical University, we have palliative department also. If the patient who has nothing to do, even by giving treatment, chemotherapy, radiotherapy, immunotherapy, hormone therapy, even any treatment or surgically, if you could not manage, then palliative treatment is given, and if necessary, the patients will be treated in their home by giving the caregiver in from my university. Again, you all know our Honorable Prime Minister Sheikh Hasina. She has given a lot of success in health sector, as because our community clinic, that is about 6,000 population, about 14,000 community clinic in the rural area, they are getting much more. One of the example is that in our country previously there was 30,000 night blind people due to malnourished and lack of vitamin A. We have the study that per year there was 30,000. After giving vitamin A capsule in EPI program, now the number of night blindness are decreased to one-third, that is 10,000 per year. So this is one of the unique EPI program which is going on, and including the vitamin A capsule. One of the, I am the ophthalmologist, we are also thinking of ocular oncology in my department. Intraarterial chemotherapy, this is not being given even today. And one of the staff of my university asked me that I want to go for the treatment of my baby to the India. Then I asked my specialist, oculoplasty surgeon, why you are not in a position to give the intraarterial chemotherapy in this situation. They have not yet developed. I hope in future it will be given in my university. You all know that our Honorable Prime Minister have taken the decision that in 8 divisions, there will be 8 centers, 8 hospitals, a specialist hospital, where there will be one will be cardiac, one will be nephrology, that is dialysis, and another part will be cancer. So I think many patients will be able to be relieved from this type of cancer in the divisional area. But the man behind the machine, or the people, that is the specialist number, should be increased in different parts of Bangladesh also. We hope in future, as our government is now moving fast, during the corona, we have seen that our government has given free of cost 36,000 crore amount for giving vaccine free of cost. Also, about 41,000 was given incentive to the people. And also, in Corona, the management was very good. That's why we were in such management position that in Southeast Asia, our Honorable Prime Minister Sheikh Hasina became the first in Southeast Asia and 5th position in whole world. You all know that in USA, one of my colleagues, though he's the son of the soil, he's with us. In USA, there was the death in Corona was 10 lakh. And in Bangladesh, it was 30,000, though according to population, it would be 60,000. So the management was very good here. That's why I think management in every sector, including in oncology sector, if we come forward, if we increase the number of specialists, and also if we have the united effort, I think we will be able to be successful one. I wish the success of this summit, Dhaka Cancer Summit 2023. And I also believe that for every mountain there is a miracle, which was told by Robert Schaller. I hope with this conference, there will be the dissemination of our knowledge, and we will be able to be successful by giving knowledge from abroad, knowledge from the seniors, and you will be able to treat the patients who are suffering for a long period. With these few words, I am very happy as you have invited me as the chief guest. I hope I was in the last summit also, and in future, if you invite me, and if you have any time you call me to help in any sector, I will be with you. With these few words, thank you very much for patient sharing. Joy Bangla, Joy Bangabandhu, long live Bangladesh.